Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my NPTE, and this led me to found SPT with Me, which is an NPTE prep platform. When you're studying for the NPTE, check us out at sptwithme.com for our NPTE prep courses. Now, for what you're actually here for, let's talk about Cranial Nerve XI, the Spinal Accessory Nerve. This image shows an anterior to posterior view of the thalamus and brainstem. Here you can see the rootlets coming out of the sides of the structure. However, you should note that these rootlets are not coming out of the side of the medulla, but they're actually coming out at the level of the spinal cord. Think of the upper 5 to 6 cervical spinal levels. So this image that we all know so well of the thalamus, midbrain, pons, and medulla, that's not all that there is. This also includes the spinal cord. Here's an image that takes out the rest of the clutter and hopefully makes seeing where the nerve actually comes out a tiny bit easier. This is a posterior to anterior view of the same structure, thalamus and brainstem. So this is the back side. You can see that the rootlets are exiting laterally still. Same structure and same view. However, this image now shows you where the nuclei or nucleus is of this nerve. It extends down more inferiorly toward the spinal cord, as you can see. This is a cross section of the spinal cord. We're at the level of the cervical spine, spinal cord. And here you can see the location of the spinal accessory nucleus. And it's between the dorsal and ventral horns of the spinal cord. So think about gray matter. This is now a lateral view, same structure, thalamus, brainstem, and you can see how the nerve exits laterally. Let's talk a bit more about the function of this nerve before we go more into the pathway. This nerve is purely a motor nerve, and it supplies motor innervation to two muscles, the SCM, the sternocleidomastoid, and the upper portion of the trapezius muscle. The lower portion of the trapezius muscle is supplied by the nerve roots of C3 and C4. Obviously, our anatomy does not look like this, but this is a schematic that helps you see the pathway that this nerve takes. So this is an anterior to posterior point of view. The green line is what we care about in this image because this is the spinal accessory nerve. When we're coming out of the spinal cord, you can see the rootlets of cranial nerve 11. They all combine to make one nerve. When you think about our anatomy, you'll note that the cervical spinal cord region is not in the skull. And that's why you see that the rootlets are coming out. They're below the foramen magnum, aka that big hole at the base of the skull. The rootlets combine, making one big nerve, and then it ascends through the foramen magnum. Then it makes its way to supply the motor innervation of those two muscles that we talked about, the SCM and the trapezius. Here's another schematic of the pathway. You can see the rootlets, kind of, but they are coming out of the cervical spine spinal cord. They're all combining to make a single nerve. Then they ascend and then loop back down where they're going to innervate the respective musculature. Let's talk about the testing of this nerve. Now that we know what the function of the nerve is, we should be able to know what exactly to do for the test to see if it's functioning properly. Well, if we innervate the SCM, then we're going to do a test to see whether the SCM is working or not. You're going to do an MMT. Well, if we innervate the upper traps, do an MMT of the upper traps. Hopefully this made studying Cranial Nerve XI a little bit easier. When you're studying for the NPT, check us out at sptwithme.com for our prep courses. Check out these references for more information.